Hey guys, welcome back. And today we are going to discuss about other nursing diagnosis and care plan. Today's nursing diagnosis is risk for self-harm related to suicidal ideation as evidenced by verbalization of suicidal thought and observable changes in the behavior. That is our diagnosis. And this diagnosis you can for depression, mania, and other psychiatric condition, especially for psychosis. So all these conditions will show the symptoms of suicidal ideations, or the patient will show suicidality. So in that case, definitely self-harm will be there. So you can use this nursing diagnosis. So now we are going to see the nursing care plan. As I said in previous care plans also, there are some specific columns you have to add in your nursing care plan: assessment, diagnosis, planning, rational, implementation, and evaluation. These are all the columns. Okay. In assessment column, what you will write? You will write your subjective data and objective data. What is subjective data? What your patient is saying about or complaining about their condition, that is subjective data. And objective data means what you are observing based on the situation of the patient. So what is the subjective data here? The patient complains that she or he feels scared, okay, and feeling something wrong is going to happen to. So that is their feeling. Okay, it is because of the self-harm tendency and self-suicidal ideation. They are having this feeling. They feel scared always, and they said that something is going to happen to them. Okay, wrong going to happen to them. Then what is the objective data? The patient is repeatedly doing self-harm and behaving unusually. So what you observe from the condition, that you can write in objective data. What the patient is saying about their condition, that you have to write under subjective data. So here self-harm. Okay, that is our major focus. So patient is saying that they are feeling something unusual is going to happen to them, and they are feeling scared. And what you observe, the patient repeatedly doing self-harm and behaving unusually. So second column is diagnosis. In diagnosis, what you can write? What is the diagnosis? So same diagnosis you can copy and paste here. That risk for self-harm related to suicidal ideation as evidenced by verbalization and observable changes in the behavior. And what is the goal? The patient will be free from self-harm and will verbalize an understanding of strategies to overcome this thought. So the patient will be free from self-harm and will verbalize an understanding of strategies to overcome this. So that is our goal. Then while coming to planning, okay, planning first you have to write, then rational. What is the purpose of that planning? Then implementation. Okay. At last you have to write the evaluation. In planning column, in other care plans also I said, first you have to go for history collection and mental status examination, or history collection, physical status examination. So here I did mental status examination because the patient is having unusual feeling of fear and scared and feeling something unusual happening to them. So mental status examination is more suitable than physical examination. Okay. So the first planning is do history collection and mental status examination. And what is the rationale? To understand the present mental state of the patient. And then implementer column, always write the past tense, that is do history collection means what is implementation? Done history collection and mental status examination. Second planning is do a thorough assessment of the patient for self-harm. Assessment is very important. So what is the level of self-harm? What is the severity of self-harm? To understand that, second you can go for assessment. So do a thorough assessment of the patient's risk for self-harm. For what? To prevent the self-harm and the risk of the patient. In implementation, you can write done thorough assessment and developed a safety plan. So what are all the things you have done, that you can write in the implementation. And third planning is observe for signs of self-harm. Any signs of self-harm is there in the body, or anything is triggering them, that you can observe and you can write down. So planning, observe for signs of self-harm. For what? To provide immediate support if necessary. And in implementation, you can write observed and noted all triggering factors which can lead to self-harm. Okay. So these are all the some planning. Then next, collaborate with the patient to develop a safety plan. Patient can say more than anyone what is triggering them and what can calm them. So ask your patient, so collaborate with your patient to develop a safety plan. That is the next plan. For what? To provide proper support to the patient. And what is implementation? Collaborated with the patient and collected coping strategies, okay, techniques they like to do, and emergency contact, okay, etc. Whatever you did, that you can write under implementation. The next planning is ensure the patient has access to alarm and other resources and support network. That's very, very important, because sometimes, after committing this self-harm or suicidal things, they will feel to get escape from that. So in that case, they need the access to alarm and resources to come out or to inform the necessary nurse or the person who is responsible for them. So that is the next plan. Ensure the patient has access to alarm and other resources for what? To prevent the severe complications as well as to save life. Given information and check whether the alarm switch are accessible to them. That's very, very important. Then encourage the patient to express feeling and thoughts openly and validate their experience. That's very, very important. For what? To promote communication and encourage the patient to talk and discuss the situation among other staff, and also inform the staff members also. For example, like so and so patient is having suicidal ideation, so please, if they are trying to tell something, please listen them rather than speaking to them. Okay, then after that, you can go for evaluation. In evaluation, patient has stopped engaging in self-harm behaviors and the patient started reported their feelings. So in this way, you can write the nursing diagnosis and care plan for self-harm or injury. So hope you understand, guys. This is for self-harm or self-injury. You can use this care plan for psychosis, depression, and anxiety. So the nursing diagnosis is risk for self-harm related to suicidal ideation as evidenced by verbalization of suicidal thought and observable changes in the behavior. So these are all the major plannings. Okay, you can write this planning. Hope you understand, guys. Thank you. We'll come back with other nursing diagnosis and care plan.